Halina't simulan ang inyong umaga sa mga magagandang refleksyon tungkol sa ating buhay at pananampalataya. Kasama sina Father J. Boy Gonzales at Father Nono Alfonso ng Kapisanan ni Jesus, Binibining Risa Singson Kaupeng ng Feast Magazine, Father Fiel Pareha mula sa Archdiocese ng San Fernando, Pampanga, at Cardinal Luis Antonio Tagle. Dito sa Kapet Pandasal sa Radyo Katipunan 87.9 FM.
Jesuit Music Ministry, your daily dose of inspiration. Follow JustCom PH on Spotify and JustCom Music on YouTube. We are also on iTunes and Deezer.
Let's take it back to the songs of your time. This is The Throwback on Radyo Katipunan 87.9 FM.
We all want to live healthier in mind, body, and spirit. But where do we start? Sometimes, all it takes is a good conversation. Tune in to Wellness Wednesdays on Radyo Katipunan 87.9 FM. Together with experts, inspiring guests, and real stories, we explore tips you can actually use. From managing stress, to eating better, to finding balance in a busy world. Because here, we believe wellness isn't just about living longer, it's about living better. So join us, and let's make every Wednesday a step toward your healthiest self. Wellness Wednesdays, wellness that speaks to you, from the body, mind, to might. Every Wednesday on Radyo Katipunan 87.9 FM.
Follow at Radyo Katipunan in our social media accounts on Facebook, Instagram, and on Twitter.
Radyo, 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 Radyo Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagpapalitang tumpak at damo. Buhay at tumsum sa labas ng eskwela, ibibida ang ibibida. Radyo, 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 the voice of the Blue Eagle, the voice of the Blue Eagle.
Tawag ni Ignacio, Katipunero, sugat mo todos sa kayo, tulo at tulo. Lipag na lumigil, hindi na bigil.
Blue and white, Monday fly. Radyo, 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 the voice of the Blue Eagle, the voice of the Blue Eagle.
Katipunan.
Radyo, 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 radyo Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo, radyo, radyo Katipunan. Radyo, radyo, radyo Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, radyo, Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero, sugod, todo sa kayod, tulong at tulong. Lipad ka Blue Eagle, galing hiting at tigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan.
Coming up next, Cura, conversations on care, health, and healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Radyo, Katipunan. Radyo, Katipunan. Kawal ni Ignacio, Katipunero, sugod, todo sa kayod, dunong at tulog. Lipat na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan. Radyo, 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 Katipunan.
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion where care meets conversation.
Alright, magandang gabi Ateneo and welcome back to Cura, Conversations on Care, Health and Healing. I'm Dr. Jello Apostol and you're listening to us at 87.9 FM. We're also on air at zeno.fm/radio RK879 FM. And of course, you can listen to us on Facebook and on Instagram and at YouTube. So today, I'm so excited to dive into a topic that affects almost every Filipino family, especially during the rainy season and the colder months, childhood flu. Now, I know what you're thinking, it's just a flu. Flu lang naman yan. Kids get sick, they recover. But here's what many people don't realize. Influenza is not just a bad cold. It's a serious respiratory illness that sends thousands of especially Filipino children to the hospital every year. And in a country where we face overlapping health challenges like flu, dengue, COVID, respiratory infections, understanding flu, all the more becomes very critical. So today, we are so glad to have with us Dr. Chesca Layug-Dionglay. Dr. Chesca is a general pediatrician who handles these kids with cough and colds, including the flu. We'll cover what flu really is, how to spot it early, when to worry, how to treat it at home, when to rush to the ER, and most importantly, how we can prevent it. So whether you're a parent, a teacher, a caregiver, or anyone who works with kids, this episode is for you. So let's keep our kids healthy and our families prepared. So Dr. Chesca, welcome to Cura.
Thank you for having me, Doc Jello. This is such an exciting topic to talk about because we're in the thick of flu season and it's so common. Every kid gets the flu, every kid gets cough and colds.
So agree. But Dr. Chesca, before we even talk about the flu, let's talk a bit about you muna, diba? You're a pediatrician and you also work as a school physician. What eventually led you into this calling of working with kids?
So I love kids. Kids are the funniest, they're the silliest, they're the cutest, they're the most honest human beings, but they're also so resilient. So it's a privilege to be given the trust by families to take care of their kids when they're sick. And also a great privilege to guide parents on how to build healthy habits for these kids.
Like sometimes kids are just better than adults, no? Plus they're cuter.
Plus they're cute.
Yeah, agree. And as a pediatrician and also as a school health physician, I'm sure you are at the forefront, no? The front lines of childhood illness every year. I mean, what keeps you passionate about this work? What keeps you going? I'm sure, being a pediatrician comes with its own set of challenges.
Yeah, as a pediatrician and even a parent myself, no, I understand how worried we can get when our kids are sick. So when you're able to help a worried parent understand what's happening and then you see their child recover and bounce back to their usual playful self, it's just rewarding.
I know. And and the trust, diba? You were mentioning earlier, like the trust and the relationship that you
Yes.
have with the parents and the kids.
Yes.
So, now, before we get into the details, I think it's very important for us to frame something important. We're in late November 2025. And tama no, Doc Chesca, this time of the year is flu season in the Philippines. Diba?
That's right.
And it typically peaks during the rainy season and the cooler months, no? Roughly around June to December, peaking in sometimes September and October. So, right now, Dr. Chesca, are you seeing a lot of flu cases, whether in the school or in your clinic?
Yeah, so there's still a significant number of kids who are sick lately. So if you remember, around October, we had a really bad wave of influenza and respiratory cases that sent a lot of schools into a health break, actually, even Ateneo included. But lately, yeah, we're still seeing a lot of kids with cough and colds, but they're not typically due to influenza. They're other viruses that cause the common cough and colds.
Yeah, and that was fairly recent, no? Parang, di ba? I'm sure there were some schools who actually had to cancel classes because of so many
Yes.
cases. But siguro, Dr. Chesca, a lot of people think flu is the same as ubo, sipon. Di ba? Is it viral or is it bacterial? So, let's maybe just set the record straight to our listeners.
Yeah.
Is influenza the same as ubot sipon?
Okay, that's a really good question. So, flu and colds are used interchangeably kasi, no? But they're actually different things. So, influenza is caused by the influenza virus. So, there are different types of influenza viruses. So, there are 3 types, A, B, and C. So, it's mainly a respiratory infection that causes cough and colds, but it will also cause other symptoms like high-grade fever at the onset, body ache, sakit talaga ng katawan mo, even headache and vomiting. On the other hand, the common cold naman, or the common cough and colds, is usually caused by other viruses like rhinovirus, adenovirus. So they're usually milder, but yes, they cause cough and colds. Yes, some low-grade fever, but they usually come on gradually. So it's not as debilitating as an influenza where you have like high-grade fever, di ka na makatayo sa bed.
So I think, no, to our listeners, that's a very important clarification, no? Thank you very much, Dr. Chesca, kasi I'm sure a lot of people tend to confuse these terms, these conditions with each other. So what I'm getting is that if it's flu, talagang baldado talaga, no? So you have the fever, can't move, can't really function. And then if it's just like cough and colds, it's probably from another virus. And it's really just cough and colds. Is that correct, Dr. Chesca?
Yes, that's right, that's right.
So like if your kid is like still playing around, still being their makulit, cute selves, pero may ubot sipon, hindi naman nilalagnat, it's probably not influenza.
Right, that's correct.
Now, is there a way kaya? No? So you've mentioned kanina, Dr. Chesca, that there's the influenza virus and then there are also other viruses which cause your cough and colds. Is there a kind of test or a way to diagnose or differentiate them from each other?
Good question, no? So we actually have rapid tests, like nasal swabs.
Meron na. May
Yeah,
test.
we do have that. We have that in the hospitals. So these rapid tests are nasal swabs, then you can get the results in like 15 to 20 minutes. But these are not sensitive or specific. The bigger hospitals would have what we call respiratory panel. So it's the gold standard for diagnosing these types of viral infections. So it's a nasopharyngeal swab.
Ibig sabihin talagang ipapasok talaga yan sa
yes.
likod. I think parang we all remember that from COVID,
Yes,
di ba? Yung
the same one. It's the same kind of
gosh.
swab. The results take slightly longer, but it's the most accurate test that we can do. So it's available in a lot of the big hospitals, and we typically use it to test kids who are hospitalized, the high-risk children in respiratory distress, or when diagnosis would change our management, like deciding if should we give an antibiotic or an antiviral.
So, Dr. Chesca, so there is a test, no, to differentiate your influenza from the ubot sipon and the other viruses. But I guess like remembering the experience during the COVID-19 pandemic, it's uncomfortable. And I'm sure it's expensive.
Yes, it's uncomfortable and expensive.
So is it absolutely necessary? Like say for example, you see some signs and symptoms of influenza. Is it absolutely necessary to have it tested? Like what's the added value of having it tested? Or when is it necessary kaya?
So we usually do the testing again for those high risk kids, no, when they're hospitalized. When we're deciding whether to give an antibiotic or an antiviral. But most of the time, we can treat empirically. Like if you have classic symptoms of influenza, then we treat empirically. Or if you have classic symptoms of like a typical cough and cold, then we'll give supportive management. So it's not always required to do the respiratory panel or a nasal swab for that matter.
And your doctor will tell you when it will be absolutely necessary.
Yes.
So like you don't push for it kasi it's uncomfortable and it's
Yeah.
also expensive. And I guess like what you were saying kanina, it becomes even more important actually to know how it spreads, no, or how it's transmitted more than what kind of tests, di ba? Parang mas mahalaga na malaman, like, where do you actually get the flu? So, Doc Chesca, please explain to our listeners, how do you exactly get flu? How is it transmitted?
Yeah, so flu is a respiratory virus, no? So it spreads through respiratory droplets. When an infected person coughs, sneezes, or even just talks, and you happen to inhale that saliva, or it lands on your mouth, it lands on your eyes, then you can get infected. But you can also get infected by touching contaminated surfaces with the virus. So after touching those surfaces, you touch your eyes, rub your eyes, you touch your nose, you eat fries, you put your fingers in your mouth. So, but here's the scary part. People can be contagious even before their symptoms start. So a person could be incubating the virus, no symptoms, but could be already spreading the infection.
And I guess like, now that you say that, Doc Chesca, I can only imagine, like, say, for example, for our kids, no? In classrooms, or like sometimes in the school bus, or like when they're playing with other kids, no? Parang there's absolutely no way for them to know, di ba? And, not just for kids, but like, for many of us, sasakay ka ng magko-commute ka, especially if you take public transportation, di ba?
Yeah.
Or you go to the mall, especially when it's crowded. I guess as an environmental health researcher, di ba? Parang we need to be mindful as well of the kind of environments where it becomes very easy for you to pick up the flu virus, right?
Yes,
So,
in crowded settings, definitely it's easier to pick up these viruses.
so, and like sometimes wala rin tayong choice di ba? So, is it correct to think that way, na wala talaga tayong choice when it comes to the environments that make it easy for us to pick up flu?
Well, we can do some simple measures at home, like ventilation, opening the windows, using fans to circulate the air, spending time outdoors, so these reduce transmission. So during flu season especially, you can also practice good hand hygiene, masking.
Oo, kasi di ba sabi mo kanina, parang during flu season, it's very easy for you to pick up something that has been held by someone with
Yes.
flu, and then isusubo mo, or you touch your face.
Yeah.
Sometimes you forget these things, di ba?
Yes, and it's also, the pandemic taught us how to alcohol frequently, wash our hands frequently. So I think that's one good thing that we picked up from the pandemic.
So like basic things talaga. And I'll add, ventilation, di ba? Parang very important na even as you find yourselves in very crowded spaces, there's always a way for you to mitigate the risks, di ba? Like open the windows to ensure that there is airflow,
going
di ba?
outside, yeah.
Or spend some time outdoors, di ba? Especially when it's not raining. Now, Dr. Chesca, I'm sure a lot of our listeners are also at a place wherein they're thinking, flu lang yan. Parang di naman nakamamatay yan. Is it correct to think that way? To, I guess, parang not take flu as a serious concern? In your experience?
Well, not all kids will react the same way to a virus. So not all adults will react to the same way to a virus as well. So for the immunocompromised, for the young kids, for the elderly, their immune systems are still developing, or their immune systems have been weakened. So they're at higher risk for getting severe influenza. So they're really the people that we need to protect and take into consideration.
So, particular attention to those who are more vulnerable. diba? Especially the elderly, the immunocompromised. But I guess like just to set the record straight, I'm sure a lot of our listeners are thinking of this question. No? Nakamamatay ba ang influenza?
Yes, we've had cases wherein we've had deaths from influenza, and actually thousands really die across the world from influenza. It's a rare complication, but it happens. You know,
And what are the other complications aside from death?
More commonly, that would be ear infections. So that's a bacterial infection of the ear. But you could also get viral pneumonia caused by the flu virus, or you can get a bacterial pneumonia that develops on top of the viral infection. You can also get dehydrated, worsening of the chronic conditions, like if a kid has asthma, you can go into exacerbation. You can also get inflammation of the heart, of the brain. So especially in young children and the immunocompromised who don't really have that strong enough immune system yet to fight the virus.
So hindi siya pwedeng ipagsawalang bahala lang because it can get worse. Diba? It can definitely get worse. So I really hope that to all of our listeners, I hope that's like what Dr. Chesca mentioned. No? I hope that's enough for us to not take it too lightly. Diba? But siguro, what we are also hoping to have today, no, for our episode is to make this as practical to our parents, no, our caregivers. Kasi usually, when these symptoms of influenza do appear, it's the parents and the caregivers who usually detect it. So, say for example, Doc Chesca, your child has cough and colds, and you as a parent, parang nagsususpect ka na this might be flu. What would you advise that parent? What should they do at home? Agad-agad ba dadali na sa ER or?
So the goal first and foremost is to keep the child comfortable and hydrated. So you can manage at home. For fever, body aches, you can give paracetamol or ibuprofen, of course, in appropriate doses based on the weight, not the age. For hydration, offer small, frequent fluids, food. Their appetite might be poor for first few days, but as long as they're active, they're alert, they're peeing every 6 hours with light-colored urine, and they're more or less hydrated enough. Yeah, but rest is also crucial, so keep them home if needed. Let them sleep as much as they can.
Talagang back to basics talaga siya. It's not really super complicated. Proper nutrition, adequate hydration, enough rest, and TLC, di ba?
Yes.
Tender loving care is very important, and rest, no? But just real talk, no, for our listeners. Like, many parents also keep in their refrigerators and in their medicine cabinets, some medicine that has been used in the past, di ba? Like, what do you think about that? Would you recommend that parents use over-the-counter cough and cold medicines and like play doctor with their kids?
So generally, over-the-counter medicines don't really shorten the duration of days that they're sick. So even if you take medication early on in the illness, let's say, ayaw kong lumala kasi yung ubo-sipon niya. Taking those meds won't actually stop an infection in its tracks, no? So most of these meds are also not proven to be better than placebo, and they actually have side effects. So I think what parents also need to understand is that cough is protective. We don't necessarily need
Cough is protective?
Yes, hindi natin
How is it
kailangan
protective?
pigilin yung cough. So it clears the mucus from the airways in our lungs. And if we don't cough it out, then that's going to stay in their lungs. So we don't necessarily want to stop that cough.
And there are certain medicines that prevent, I guess, like your brain or your reflex from coughing. So, cough is the body's way pala to get rid of the phlegm and the virus. Okay.
Yes.
Oh, wow. How about, kasi, so you have the cough and cold medicines, and I think sana po naging klaro yung sinabi ni Dr. Chesca na in general, wag tayong very trigger happy when it comes to giving our kids the over-the-counter medications, even as they are already in your refrigerator, nakastock sila or in your medicine cabinet, di ba? But over the past few years, we've also seen, accessibility of what we'd call antiviral medications that especially target itong influenza. No? You have medicines like oseltamivir, no? I think many of our listeners know it as Tamiflu, and then antibiotics. Ang dami pa, di ba? So it's not just like cough and cold medicines, but you have these antivirals and antibiotics. When are these appropriate, Dr. Chesca?
Okay, so firstly, when a child has cough and colds, you can do some like natural supportive remedy at home. Like you can give them honey if your child is 1 year old and above. So honey has actually been proven, to shorten illness duration.
Pero dapat pure honey.
Yes,
Dapat
yes.
pure
Pure
honey.
honey, pure honey. For nasal congestion, there are a lot of studies now about saline drops that actually shorten the number of days your kid has a cold. But on the topic of like antiviral versus antibiotics, so I'd like to explain first that antivirals are for viruses and antibiotics are for bacterial infections.
And Dr. Chesca, why is it important for parents? I think we need to be able to explain to our parents why it's important for us to not mix up the two and how it can be very dangerous.
Yes, so we don't want. Well, if you treat a virus with an antibiotic, then of course it's not going to work and it's just going to contribute to the antibiotic resistance. So on the topic of Tamiflu for influenza, if you have a confirmed influenza infection, then you can give Tamiflu, which is most effective within the first 48 hours of onset of symptoms. So,
But of course with the prescription of the doctor.
Yes,
Diba? Hindi
definitely.
pwedeng, kasi nakatago lang tapos bigay na agad.
yes,
Okay?
yes.
Alright. And siguro, Dr. Chesca, because for our listeners, we're also just recently celebrating World Antimicrobial Awareness Week or Antimicrobial Resistance Awareness Week. You mentioned antibiotic resistance kanina and how when you give antibiotics for a disease that is actually caused by a virus, it can contribute to what we'd call antibiotic resistance. For our listeners, Dr. Chesca, how might we explain in simple terms what is antibiotic resistance and why they should be scared about it?
Okay, so when we keep using too much antibiotics frequently, these bacteria will evolve. They will evolve into a type of strain na hindi na tinatalaban ng antibiotic. So when you use an antibiotic again, resistant na siya, hindi nagagana yung antibiotic.
Hindi nagagana yung antibiotic.
Yes.
Oh. And because of that, what happens? Like you'll need to
step up the antibiotic, keep stepping up until wala na tayong antibiotic na magamit.
Oh, and that can be really scary, di ba?
Yes, of course.
I'm sure, di ba, parang like when you step up the antibiotics, the cost also increases.
Yes.
Di ba? When you use like a stronger antibiotic, it's usually a more expensive antibiotic.
Yeah.
So, pakinggan po natin si Doc Chesca, no? When you have a viral disease, don't give antibiotics. Kaya dapat din po ay huwag tayong trigger happy when it comes to giving antibiotics.
Yes, so viruses are actually the most common cause kasi of the cough and the colds. And influenza is a virus, no? Mm-hmm. So, but again, there's a point naman for the antibiotics. So, if you have a viral infection kasi, it also predisposes naman to a secondary bacterial infection. So, typically, like, the picture would be like, your kid has a cough and colds for like 3 to 4 days now, and then suddenly, biglang, parang they're feeling worse, they got fever na. So, yung mga ganon, your physician would be inclined to think na baka there's a secondary bacterial infection. So, that's the only time that we give antibiotics, no? It's not for all cases of
and always
infections.
with guidance from the
Yes.
physician. Now, ito, Dr. Chesca, I'm sure this is another critical question that our parents would want answered, no? When should they start worrying? I mean, I think you've mentioned earlier that sometimes influenza can be managed at home, but like, when would you know if this is actually something a lot more serious and hindi na pwedeng sa bahay na lang and you might have to bring your child to the ER?
So you would want to go to the ER immediately if your child has any difficulty of breathing, labored breathing, like you can see the ribs when they breathe.
Talagang hinihingal na,
Hinihingal
no?
sila. Or fast breathing, their nose like flares up kasi we call that air hunger, alar flaring. they're
Lumalaki
having a
yung
hard
butas ng
time
ilong.
breathing. Yeah. Of course, when they're dehydrated, like they're not peeing frequently anymore. There are no tears when they cry. Very dry mouth. They keep vomiting everything that they're eating. So these would warrant definitely an ER visit already.
So I think, no, I hope our listeners got that, no? If difficulty of breathing, tapos vomiting, other symptoms na talaga, di ba? And dehydration.
Yes.
Those are, I guess, like parang some kind of like red flags or warning signs that we need to be mindful of. But Dr. Chesca, many parents, they usually base their decision on fever. Sinasabi nila, nangangwarenta na yung anak ko, kailangan na itong dalhin sa ER. Or actually, minsan nag-confuse pa nga eh. Parang, anak ko, 37 na. or 38 na, kailangan na itong dalhin sa, sa ospital. So, is fever a good indicator as to when you should bring your kid to a healthcare facility?
I know it's nakakapanic, no, as a parent, di ba, pag nilalagnat yung mga anak natin. Pero the degree of fever alone isn't the best indicator. So, a child with 40-degree fever but still smiling when the fever goes down, still playing kapag tumatalab yung paracetamol, versus a child who is like 38.5 lang pero lethargic, not drinking, looks very ill, then that would be more concerning, no? Rather than the child with a higher degree fever but is otherwise feeling okay. But that said, infants under 3 months old with any fever for that matter need immediate medical attention. For older children naman, sustained high-grade fever like 40 degrees or higher, that's more than 3 to 5 days na, then that would warrant a medical assessment from your physician.
So yun po yung importante doon, no? Na parang hindi porket mataas yung fever at yun lang yung titignan natin, no? Kailangan tignan din yung presence of other symptoms like vomiting, talagang naghihina na, lethargy yung tinatawag natin, di ba? Dehydration, and not just the fever.
Yes.
But your nuance is that for very young kids, tama, 3 months?
Under 3 months.
Under 3 months. And if the fever is tuloy-tuloy na mataas,
yes,
diba, like 2 or 3 days na 40 degrees Celsius, then that would warrant already a healthcare consult. Dr. Chesca, so typically, how long would the flu last? If this was caused by the influenza virus, of course, we know that each patient is different, but like based on the patients that you see, typically how long are they with the disease?
So most of the kids will present with a cough, colds, and feeling ill for about 3 to 7 days. So the fever will usually resolve in like 3 to 5 days, but the cough really matagal, like minsan 2 weeks, inuubo pa rin sila. But most of these cases, no, are what we call post-viral or post-infectious cough. That can sometimes nga they can last up to 2 months.
Pero kapag ganun, pwede pa sila makahawa o hindi na?
When it's post-infectious cough, hindi na sila nakakahawa. So the period of infectiousness or yung period na pwede kang makahawa is usually like 5 to 7 days from onset of symptoms. But if it's been like 2 weeks already, tapos improving na yung cough, pakonti-konti na lang yung cough niya, hindi na siya nakakahawa.
Oh, I think that's very important po, no? Na sometimes it's possible pala na hindi na nakakahawa, parang wala na yung virus sa katawan, pero may konting symptoms. Diba?
Yes.
So I think the magic number is like typically 5 to 7 days.
5 to 7 days is the average.
Average.
Yeah.
Pero I think that's also the time when they'd want to also go back to the doctor to ask for clearance, no? And I guess this is also another practical question. Kasi di ba parang when 5 to 7 days tapos mag-absent pa yung kid, di ba parang they'll miss a lot, di ba? And we know that like makamiss lang ng isang quiz. As
Marami nakahabulin.
Marami nakahabulin. So I'm sure a lot of parents are also asking like how soon can my... And it also affects the parent din, di ba? Kasi when you have to take care of your child, like some parents, they also have to, to skip work, di ba? They have to be absent from work. So I'm sure another practical question for our listeners is like how soon can the child return to school or to go outside and interact and play with other kids?
So usually, we want to keep the child at home until they have been fever-free for at least 24 to 48 hours without requiring like paracetamol or ibuprofen to lower down their fever. And of course, they should be well enough. They should be feeling well enough. They should be eating. They should be more active already. And I know it's hard for working parents, no, but if you send a sick child to school kasi, then it spreads lang. The cough and the colds will spread lang more to the classmates and the teachers, no?
And I think it's also an opportunity for you to coordinate with your physician, di ba, with your pediatrician. It's a decision that you don't necessarily need to make yourself. And anyway, yung back to work clearance ay manggagaling din naman sa doktor. And I think importante yung sinabi mo na wag ding aapurahin, di ba? Kasi you don't want to create another problem. So, ito, I think, Doc Chesca, our conversation so far, you've clarified a lot of things for our listeners. How flu is not caused by a bacteria, it's actually a virus. It's different from your common, typical cough and colds, di ba? There's something unique about it. We shouldn't be giving antibiotics or should be trigger happy when it comes to giving medications, even if it's something that's already in our, storage or refrigerator. So, I think very, very helpful na yung napag-usapan natin kanina. But I'm sure there are still a lot of myths, surrounding influenza. And now we go to one of our more exciting segments here at Cura, our fact or myth, where we will be busting some misconceptions about the flu. So, Doc Chesca, first, pwede ka daw magka-flu kapag nagpaulan ka, if you take a bath under the rain, or if you sleep with your hair wet.
That's a myth. That's a big
myth.
So,
Okay.
flu is actually caused by a virus, not by cold weather or wet hair. So again, you can get flu by breathing in the virus from an infected person who has the flu or touching contaminated surfaces. So, okay lang po na matuyuan ng pawis, okay lang po na maambunan, okay lang po na matulog ng basa ang buhok, okay lang na tumapat sa electric fan.
Marami pa rin sabi na bawat Pero, Doc Chesca, feeling ko we need to convince our listeners further kasi they will say, but Doc, I saw and felt it with my own eyes and, my own experience na pagkatapos maulanan, nagkasakit. Pagkatapos matulog, ng basa ang buhok, nagkasakit. Pagkatapos matuyuan ng pawis sa likod, nagkasakit. If we say that it's not necessarily these events that causes the flu, but something else. Like, how then do we convince parents who say, we've experienced it and we actually got sick because of this? Like, how might we explain it to them?
So in general, viruses are suspended in air longer during the rainy season and the cooler months. So if you get sick a day after naulanan ka, it's most likely because you caught a virus when you were walking in the rain. Not because napatakan ka ng raindrops on your head. If parang nagkasipon ka after mo matulog sa super lamig or tumapat sa air, sa fan, so it's most likely because the cold weather the cold air actually can really predispose to colds in general, but it's not necessarily caused by the virus when you get a cold from that.
So see, may explanation po. But still, it stands that it's not the rain, it's not the pawis, diba? There is a virus that is causing the influenza. Alright, ito, Doc Chesca, I think it's also important to note that there is a vaccine pala for influenza. And Doc Chesca, is this a one-time thing to get the flu vaccine? Or like how often should we get this flu vaccine, Doc Chesca?
So the flu vaccine is recommended annually, so every
year
for kids 6 months and above, and even adults.
Mm-mm.
So we usually give the flu vaccine around the summer months. So that'll be around like March, April, May, June. That's when the flu vaccine for the year is ready in preparation for flu season come the rainy months.
June to December. So dapat mas maaga. Huwag po nating hintayin pala na pumasok tayo dun sa flu season. Bakit gano'n? Parang, is it because like you'd want the vaccine to sort of like build your immunity?
Correct.
I see.
Yes.
So wag hihintayin yung flu season na, dun ka pala magpapavaccine. So, summer months pa lang, a couple of months ahead, magpa-vaccine na so that you're fully protected in
For the
time
flu
for the flu season.
yes.
Pero ito, the question, fact or myth? Some people believe, Doc Chesca, that the flu vaccine itself can cause flu. Fact or myth?
That's actually a myth. No?
Okay,
So
myth.
the flu vaccine contains inactivated dead flu virus. So it cannot cause the flu. But you can get muscle soreness or a bit of low-grade fever or a bit of fatigue after you get the vaccine. But it's not the flu. If you get sick, for example, nagka-cough and colds ka talaga, tapos like high-grade fever talaga, it's likely because you're already incubating another virus or the flu virus.
Even before you were vaccinated.
Even before you were vaccinated. So the vaccine itself cannot give you the flu.
Yeah. And tama ka, di ba? Parang sometimes, especially young kids, di ba? Parang after the vaccine talagang may like low-grade fever lang. So these are normal post-vaccination
Yes.
reactions. So again po, no, the flu vaccine does not cause the flu. Okay. Another common thinking among our parents is, kasi syempre nabanggit nga natin, the flu vaccine, you have to get it every year. But some parents or some people think, nagka-flu na ako, so baka hindi ko na kailangan ng vaccine. So if you've had the flu before, you no longer need the vaccine. Fact or myth, Dr. Chesca?
So that's a myth, no? Myth. The influenza virus has a lot of strains. It mutates very easily. So having one strain doesn't, if you've had the influenza, you've had likely one strain, and it doesn't protect you against the other strains that they're circulating around, no? So if your child got flu early on in the season before being vaccinated, you still need to get vaccinated to protect yourself against the hundreds of other strains of influenza that are there.
That's true. And yun nga kasi nag-evolve din yung virus eh. Diba?
Yes.
Parang, yun nga, you'd want to get the flu vaccine for the many other strains of influenza that your kid can get. And a past infection will not protect you from all of these other emerging
That's
strains.
right.
So, kailangan pa rin po, every year, magpa-flu vaccine. Ito, when it comes to treating naman, Doc Chesca, no? A lot of people think, okay, number one, bigyan ng salabat. Ay, yung tinatawag natin na ginger tea. Ang hirap, especially kasi I grew up in the province eh. Parang, even as a young kid, parang naalala ko, like, they had to force it on me, no? Yung salabat. Or here, sometimes now, parang marami nagsasabi, bigyan mo ng, or you extra dose mo ng vitamin C. Or, I mean like, of course, there's the quintessential, bigyan ng sopas or chicken soup. Which of these, Doc Chesca, are a fact or a myth when it comes to treating influenza?
So most of them are a myth with some nuances. So none of these can cure the flu virus per se, or any virus for that matter.
They cannot cure. Sopas cannot cure. Salabat cannot cure. Extra vitamin C cannot cure. Continue, Doc Chesca.
Correct. So they cannot also shorten the course of illness, but they will provide you with comfort. They will
Especially the
provide you with
sopas.
hydration. Yes, the hot sopas. So they will soothe your throat. But it will not really, cure the flu or stop the flu in its tracks.
So it's not a cure, but also we're not stopping people from offering a very hearty chicken soup. And I guess also sometimes the steam from the chicken soup, it helps with the congestion, di ba? But very quickly, yung sa vitamin C, kasi not just kids, but I know a lot of adults, if they're not feeling well, they will take extra doses of vitamin C. Does that actually work? Not just for kids, but also for adults, Doc Chesca?
So the vitamin C actually supports your immune system in general, but mega doses still won't cure the flu.
So it won't cure.
It won't cure.
Taking an extra vitamin C won't cure.
And you definitely shouldn't take mega doses either.
Kasi I'm sure ihi mo lang yan, di ba? You'll just expel it from your system. So parang sayang yung pera, di ba? Ito po, Doc Chesca, still really in relation to our previous question about vaccines. A lot of people think, especially with all of these negative perceptions about vaccination, that it's better to have natural immunity. Yung magkasakit ka from the flu than what people think is artificial immunity from vaccine. So natural immunity is better than artificial immunity from vaccines. Fact or myth, Doc Chesca?
That's actually a myth, no? And it's very dangerous for that to be said. Kasi, yeah, natural infection produces some immunity, but at what cost, diba? The influenza virus can really cause some serious complications and hospitalizations, and even death nga, no? So, why would we risk it when we have the technological advancements already to get the safe, effective immunity from a vaccine? So natural isn't always better per se. Vaccines actually train your immune system without the danger of the actual disease.
And I think like there's something very, sabi mo nga, it's very dangerous and I guess like unethical, di ba? Na parang, why would you want to subject someone just so that to a disease?
Yeah.
Just so that he can get natural immunity when you actually have a safer and I guess now, relatively accessible alternative, di ba? Siguro pangarap talaga natin na ngayon kasi parang hindi pa fully free yung ating flu vaccine, no?
Yes,
so pangarap natin na sana maging libre. So minsan libre naman po siya sa mga ibang health centers.
Some LGUs, and some health centers will offer like a free flu vaccine, but it's still not yet widely accessible for the entire country.
Ito, may mga nagsasabi din, no? I think another dangerous thought and practice is yung mga tinatawag na flu parties. Yung kapag may isang nagkasakit, no? Okay lang na mahawaan na lang lahat kasi parang High School Musical, we're all in this together. Kasi the thinking is, if the whole family gets sick, it's better to get it over with together. Fact or myth, Doc Chesca?
It's actually a myth, no? And it's dangerous then kasi you can't control how severely somebody will react to the flu virus, especially for the very young, the elderly, and the immunocompromised. So, a healthy adult might present with just cough and cold, sore throat, but a young infant or an elderly or lola will present more severely, like baka ma-hospital pa sila, baka magka-complications pa sila. So definitely, let's not risk it. Let's not risk those flu parties.
Yeah. And I think like very important na, also again, very unethical, di ba?
Yeah.
Very unfamily na hahayaan mong mahawaan yung iba, di ba? Even if it's for togetherness. I think it's better to be together in health than in sickness, di ba? And because of that, I think let's transition to, I think, what's even more, kasi we've talked about knowing the symptoms, knowing how to manage, and also very importantly, di ba, parang dispelling some myths about influenza. Pero sabi natin kanina, pinaka-importante talaga is prevention. Di ba? Huwag na nating hayaan na magkasakit. And I think we've talked about vaccination a bit. So, a lot of people say that the single most effective prevention for influenza is vaccination. Do you agree to that, Doc Chesca?
Agree. Most definitely agree. So it's recommended annually for everyone 6 months and older, with priority, of course, for the high-risk population. So again, in the Philippines, the flu vaccine is available mostly in private clinics, no? But some LGUs and some health centers will offer it.
So you'd absolutely recommend that everyone gets a flu
Yes,
vaccine?
so it will protect you against the influenza virus. But, some people kasi will say na parang, nabakunahan naman ako ng flu, bakit nagkasakit pa rin ako?
Oo, di ba? May mga ganun din
may-
di ba? So like how do you explain it otherwise? Or how do you convince them otherwise? Na parang, especially yung mga, kasi marami nagsasabi na ganun na parang, I got a vaccine but it still didn't stop me from getting the flu anyway. So maybe the vaccines don't work. So like how might we convince those persons who experience that way?
So, firstly kasi, the flu vaccine protects against influenza strain. So, it won't protect you from the many other viruses that cause cough and cold. So, pwede ka pa rin magkasakit. But, the flu vaccine will protect against the severe complications of influenza virus itself. So, it will protect you from hospitalizations from influenza, from complications from influenza, But the effectiveness varies, no? Like 40 to 60%, depending on the season and how well the vaccine strains match the current circulating strains. But again, pwede ka pa rin magkasakit from other viruses. And pwede ka pa rin magka-flu, but milder version.
But milder. So, definitely, may protection talaga. And the vaccines really do work.
Yeah.
Doc Chesca, because yung flu vaccine nga, di ba, parang it's not free. And I think like sometimes you can get it for like 500 pesos or like 700. Sometimes as expensive as 1,000, 2,000 pesos. So, it may not necessarily be accessible or affordable to all. And then now we're saying you have to get it every year. Why can't you, why does it have to be annual? I'm sure a lot of our listeners are wondering that. Parang, why do we have to get it annually? Like, why can't one flu shot protect us lifetime? Kasi may mga vaccine na lifetime eh. Pero bakit itong flu virus, why can't we have a lifetime flu virus? Why do we have to get it every year? Can we explain to our listeners?
So the flu viruses kasi, they mutate rapidly. Each year, the composition of the vaccine is updated based on the circulating influenza strains. So last year's vaccine may not match this year's viruses. Secondly, the immunity from the flu vaccine, it wanes over time. So still, annual vaccination ensures optimal protection for you and your kids.
So, because it's a virus nga, no, it mutates very rapidly. And I guess like the vaccine that they developed for this year only protects you for those viruses. But, you know, there's no really knowing how the virus will mutate again next year. That's why you need to get another flu shot. Yeah. So, pero yun nga, sana pangarap talaga natin, no? Sana mas maging libre. Kasi, you know, in some other countries, it's actually free for all citizens, diba? So, i-advocate po natin yan, diba? And I think kanina, you've mentioned na, diba, Doc Chesca, na ideally, you don't want to wait for the flu season to start to get vaccinated.
Yes.
No? Can you please repeat to our listeners, Doc Chesca, when is the ideal time to get vaccinated or to receive your flu shot?
So the best time to get vaccinated is in the summer months. That's March, April, May, before the flu season comes during the rainy season. So the flu season usually starts about July. It will peak September, October. May mga nagkakasakit pa rin ng November, December. Sometimes there's also another peak in January, February, especially after the holidays, na madami tayong gathering, so magpipeak ulit yan.
Yeah, so there's a right time. Again, the key message is don't wait for the flu season to start. No? During summer, magpabakuna na para pagdating ng flu season, June, July, onwards, full on na yung immunity. Full protection na. Doc Chesca, we do recommend flu vaccination, but are there certain children or are there certain conditions wherein it might be contraindicated or they shouldn't get the flu vaccine?
So very, very few. Some contraindications are if the infant is under 6 months, then they're not yet ready for the flu vaccine. If the child or any adult for that matter has had a severe allergic reaction to the previous flu vaccine or has a severe egg allergy, severe meaning like anaphylaxis talaga, then those would be contraindications to the flu vaccine.
So, dapat alam din natin yung allergy history, no? Because some people might be allergic pala to the components. Mm-hmm. But is that very common, Doc Chesca? Like people who are allergic, do you see that a lot in your practice or in your patients?
I have never seen anyone with an allergy to the flu vaccine. Sometimes they will get like a mild rash after a vaccine, after the flu vaccine, but it's not also a contraindication to getting the flu vaccine yearly. So only if you've had a severe allergic reaction, like na-hospital ka for anaphylaxis, that's the only time we'll not give, you know, the flu vaccine
anymore. And I guess like parang, kasi matagal na rin yung flu vaccine na yan. I'm sure through the years, they found a way to make it as
safe,
as possible, no? To as many people as possible. But nabanggit natin kanina that vaccination is truly one of the most effective strategies to prevent flu, but it's also not the only strategy. So, aside from vaccination, which we recommend, Dr. Chesca, what other strategies do you think are truly critical when it comes to preventing influenza?
So, hand hygiene is crucial. You have to teach kids to wash their hands with soap and water after using the bathroom, before eating, after coughing or sneezing. Teach kids the proper respiratory etiquette. So, when you cough or when you sneeze, cough into your elbow, not your hands. Kasi if you cough into your hands, magkakalat ka lang ulit ng virus when you touch other surfaces, no? Discard your used tissues immediately and don't touch your face, especially your eyes, your nose, your mouth, if you haven't washed your hands. So these simple habits dramatically reduce the transmission. But of course, we also want to work on natural immunity. So we want to support a healthy lifestyle, which would support your immune function. So eating well, a diet rich in fruits, vegetables, natural whole foods, low in processed food, works wonders for our immune system talaga.
So, ang ganda ng hygiene, no? Parang, it's really the simple things, no? Proper hand washing, again, with soap and water. Pwede ba ang puro alcohol lang? Kasi, hindi, mag-alcohol na lang ako. This like, frequently spraying alcohol, is that a good alternative, an adequate alternative to proper hand washing?
Of
with
course,
clean water and soap?
when soap isn't available, then temporarily, yes, you could use alcohol. But the best pa rin talaga is soap and water.
Soap and water. Hindi pwedeng puro alcohol lang. At saka nakaka-dry din yung alcohol, di ba? So, dapat hindi puro alcohol, proper hand washing. And like to those who are watching us on YouTube, no? Yung sinasabi mo kanina na coughing, tama parang coughing into your elbow, parang ganito ba?
Yes.
So, you don't cough into your hands, cough into your elbow. Yeah. And I think very important, no, for parents to model this to their children. Kasi if as a parent or as a caregiver, as an adult, hindi nila nakikita na you're washing your hands or you're observing proper respiratory hygiene when you cough, parang they won't
copy it. They won't, model it also.
Won't model it. So, it's not just for kids, for adults then.
Yes.
So that we set a good example. How about masks? Parang during flu season, I'm sure a lot of people are thinking, okay, pag flu season, mag-mask na tayo.
Masks are definitely a way to, stop transmission. So definitely when it's flu season or when your child is also sick, but mild lang yung cough and colds nila, mask pa rin talaga. In the classroom, when you're commuting on the way home, masks can definitely offer some protection.
So mask, especially when kapag may na-declare na outbreak, or like parang if you anticipate that you'll be entering into a high-risk environment, like yung nga sabi mo, magko-commute ka, or you are anticipating crowds. Doc Chesca, because you are also a school health physician, parang is there something that we can also recommend to schools? Like, aside from parents, like how can schools be also partners when it comes to preventing the transmission of flu, especially during flu season?
Well, aside from, promoting and facilitating the flu vaccination, reinforce staying home when your kids are sick. Provide hand washing facilities with soap. Teach kids proper respiratory etiquette. Regularly clean also high-touch surfaces like doorknobs and desks at the end of each day. Ensure proper ventilation, so open windows.
Ventilation talaga. Kaya lang mahirap ngayon kasi many of the classrooms are air-conditioned So does that work ba? Does the air-condition, or like, I guess like, sometimes you just have to open. Diba? Open the door, like,
open the door or open the window. Just to
every now
ensure
and
the
then.
ventilation. Yeah.
Just to ensure ventilation. Diba? And like sometimes kapag may outbreak na talaga, diba, parang don't hesitate then to cancel classes or to mitigate it, diba?
Yeah.
To prevent future spread, because sometimes schools can also be a place where nagiging super spreader settings.
Definitely,
diba?
like your child sometimes comes home with a new virus like every month.
Yeah.
So,
and I guess it's not just the flu kasi I remember when my son was a kid, diba, parang sa preschool, di ba? Parang lahat ng sakit nakuha niya talaga sa preschool. So, talagang tama yung sinabi mo, Doc Chesca, na it's not just parents. Schools can also be a critical partner when it comes to preventing flu and many of these other communicable or infectious diseases.
Yes.
Di ba? So, I think, Dr. Chesca, as we wrap up, And we've covered a lot of things, no? Everything from explaining really what's the deal, what with flu, what it really is, how is it different from the other conditions that many people confuse it with. We've covered, identifying the symptoms, when do we seek for help, how to manage it at home, diba? And most importantly, how to prevent it. And I think what I like the most is really the fact or myth, di ba? Para ang dami mo talagang na-correct or na-bust the myth during that section, Doc Chesca. Given everything that we've talked today, I guess, what are your key messages? What are the things that you'd want our listeners to remember?
So number one, of course, still is vaccination. So annual vaccination against the flu. Number two is to support good nutrition. And I mean that for everyone, not just for our kids. We as adults also. Eat well, lead a healthy lifestyle, so your children can follow your lead.
So basics talaga, di ba?
Very basics that naturally support your immune system. So that it also includes exercising regularly, getting some sun, sleeping early, managing stress levels.
Tama. Speaking of the sun, di ba? Vitamin D also helps boost your immunity.
Yes, vitamin D boosts your immune system talaga. Number three would be modeling good hand hygiene, hand washing talaga, and coughing or sneezing into the elbow so you don't spread the virus further.
And I like how you said that it's modeling. Kasi, let's not rely on the school to teach our kids hand hygiene. The best teacher talaga is us.
Starts with us.
It starts with us, parents, caregivers, and it starts at home. It's not just they have to learn it in school or they only do it in school. Di ba minsan naghuhugas lang sila ng kamay pag nasa school sila pero pagdating sa bahay,
hindi na,
di ba? So, dapat consistent. Consistent. And then,
of course, keep your sick kids at home so school doesn't become, a super spreader. And lastly, of course, to know the red flags. Know when to go to the ER. So when your kid has difficulty of breathing, fast breathing, dehydration, these already require medical attention.
And I really do hope that our listeners got that. While flu can, I guess most cases of flu, especially after learning everything that we've discussed today, can be managed at home. There are some red flags that you need to be mindful of, diba? Very severe symptoms, very high, and continuous fever, diba? Lethargy or panghihina, vomiting, diba? And dehydration. Those are definitely reasons for you to seek for additional help. And I guess siguro, Doc Chesca, and I guess wearing my environmental health perspective, very important then that we advocate for healthier environments, diba? More open spaces, diba? It's significantly less likely for you to get a virus when you are in nature, diba? And for our physical spaces, diba, there are certain systemic changes that we can also promote, ensuring adequate ventilation, diba, and even supporting our parents, when it comes to having to care for their sick kids. I think these are all very important systemic changes that we need then, not just clinical.
Yeah.
So, I guess, Doc Chesca, to everyone, thank you very much for everything that we have discussed today. Is there anyone that you'd like to also greet or say hi to?
Well, of course, hello to my co-parents in grade 1. I hope all your kids are healthy and well. I know some kids are sick ulit ngayon. So marami nag-absent ngayon sa class ng anak ko. But let's all stay healthy, eat well, exercise regularly, get some sun so we can all gear up for the Christmas season.
Yes, and alam mo, Doc Chesca, maraming salamat talaga because I really believe that, alam mo, nung nabanggit mo yung mga co-parents mo sa Ateneo Grade School, gusto ko rin batiin yung ating mga co-parents, yung mga co-parents ko sa Ateneo Grade School, tsaka sa baseball team na Ateneo Grade School. I'm sure every parent, every caregiver who has listened to us truly learned a lot from your advice. And I hope, sana ma-practice po natin lahat ng prevention and lahat ng health knowledge na pag-usapan natin today. So next week, of course, Doc Tippy will be back with us again and we'll be talking about something that's relevant for Christmas, appropriate and toxic-free gifts. and toys that we can give to our kids, to our young people. Until then, no, to our listeners, to our parents, to kids, to everyone of all ages, wash your hands, get that flu shot, and keep your kids and yourselves healthy. Once again, I'm Dr. Jello Apostol, and from Cura, stay well, Ateneo.
Health isn't just about medicine.
It's about care
Community and conversation.
That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Radyo Katipunan. News, insights, inspiration. Radyo Katipunan. Down from the hill and down